It's really hard to find providers of color, providers who are immigrants, providers who kind of look like you, who speak your language. And it's really hard to do a counseling session if you're trying to talk about your trauma and then you're having to go through like a translator or things like that when already you're vulnerable because maybe you are a survivor of domestic violence.
When clients come to us and we mention like, hey, maybe therapy would be good for you, they're immediately worried about what are others going to think of me if I go to therapy. Are they going to think I'm crazy? Stigma is still there and we're working on that.
I think there should be special attention to the mental health of Asian females during this time. Just as someone who's female and who's Asian, we are experiencing something that is potentially life-threatening. Even if you don't label it trauma, you are experiencing something that's traumatic for the community.
Funding is always an issue. That affects the number of programs we can have. That affects how many clinicians we can hire. We've had to close intakes in large part just because of the clinicians. We can't hire new ones without more funding.
For sure, mental health clinicians, there's a huge shortage, but because we are specialized in servicing our community, it's much harder to recruit, attract, and also retain. We're for sure competing against big health systems as far as compensation, salary, flexibility, all of the above. It's been a long and continuous fight.